Welcome. You know, on most Sunday nights, we talk about the fun and frivolity and the big plays in the world of sports. But tonight, we have a special edition of Sports Rock, and it's probably something you've never seen before on television. Tonight, we're taking you inside the operating room. These are three words that will make even the greatest baseball pitcher shudder. Tommy John surgery. And as devastating as that surgery is, as advanced as that surgery has become, the road back from Tommy John surgery is long, painful, and offers no guarantee that a pitcher will be able to regain his top form. The surgery is named after the former Major League pitcher. Tommy John was solid, if not spectacular, in crafting a 26-year Major League career. In 1974, while pitching for the Dodgers, John snapped the major ligament in his pitching elbow, the ulnar collateral ligament. Legendary sports orthopedic surgeon Dr. Frank Jobe pieced John's elbow back together again, using an arm tendon to replace the broken ligament. More than 150 current or former major leaguers have had Tommy John surgery. The list includes current Cincinnati Reds Arthur Rhodes and Edinson Volquez, and former Red Jose Rio, who's had Tommy John surgery on his right elbow 3 times. But what exactly is Tommy John surgery? How is it done? How long is the recovery time? And if you play sports on any level, how can you avoid having to have it? Tonight on this special edition of Sports Rock, we'll take you inside the operating room as an elbow ripped apart by excessive wear is pieced back together again using Tommy John surgery. But this isn't just any elbow, and it doesn't belong to any professional baseball player. It's an elbow on a 14-year-old boy. His name is Tyler Richards, and a little more than 2 years ago right now, Tyler was pitching for the Hamilton All-Stars in the Little League World Series. In fact, the only game Hamilton won in Williamsport was the game Tyler pitched. He was 12. But now, as a 14-year-old 8th grader, pitching for his amateur team in Hamilton, Tyler has blown out his elbow. He is far too young for this injury, but far too often, doctors are seeing patients Tyler Richards' age.
A 14-year-old boy sitting on my operating room table going to get their ligament looked at and have the same operation the Cincinnati Reds and these other major league players get, that's too young.
Tim Kremchek has been an orthopedic surgeon for a long time, 19 years. Working out of the sprawling complex known as Beacon Sports, Kremchek is also the Reds' team doctor. He's also gained fame for his surgeries on players from other ball clubs. Kremchek didn't invent Tommy John surgery, but he's perfected it. He's here today for a final pre-op visit with Tyler.
It's always been kind of sore, and just never told anybody about it because I wanted to pitch, and I don't know, just got to me, I guess. The last game that I pitched.
But getting Tyler fixed will require major invasive surgery. Coming up, we'll go inside the operating room as Dr. Tim Kremchek pieces Tyler's elbow back together. Later, how you can make sure your son or daughter can avoid what's about to happen to Tyler. It's all on a special edition of Sports Rock, Tommy John surgery, and it continues next. Welcome back to this special edition of Sports Rock. You know, a lot of kids want to grow up and become Major League Baseball players. It's a great way of life. Most Major League players earn in 1 year what a lot of people earn in 10, maybe in their entire working lives. What kid wouldn't want to emulate a Major League Baseball player? 14-year-old Tyler Richards is living one part of a Major League Baseball player's life today. He is about to have major arm surgery.
Okay, you guys ready?
The former 12-year-old star of the Hamilton Little League team that went all the way to the Little League World Series